Well, I want to give a bit of an update on what's happening with coronavirus, which is spreading through China and has spread to other countries already. And there's a few things we don't know about coronavirus. In fact, there's quite a few things we don't know about it. But we are learning more all the time. But we do know about infectious disease in general already. We already know this. And this is the graphic that I use to teach the nature of infectious diseases, with particular reference to a viral disease. And this is what we call disease evolution. Now, evolution simply means change. Evolution means change. And in evolution of disease, there is change over time. So all diseases have their own natural evolution. They go through phases and hopefully they recover. Some don't, of course. The natural evolution of some diseases is terminal. But hopefully this one will be a recovery situation. But just to mention that point now, with this particular coronavirus, the novel coronavirus of 2019, the data so far from China seems to indicate that the death rate is probably around about 2% of those infected. Now, this looks like it's a less virulent virus than SARS, because SARS was about 10% mortality. It was a much higher mortality. So we're thinking about disease evolution. Now, what we have here on this axis here, we have severity of the condition. On this axis here, we have time. That's what we have here. And this bit in red, this is the period of symptomatic illness. So in red here, we have the period of symptomatic illness. So everything in here, in this bell curve, is the period of symptomatic illness, when the patient actually feels ill. But what happens is there's going to be a point of infection. A point in time, the person will have no viruses that cause the disease. A point in time later, they will have the viruses that cause the disease. And that is the point of infection. And that is just here on this graphic. So that is the point where someone becomes exposed to what we call the etiological organism, the organism which causes the infection, the etiology. Then what happens after that is the virus gets into the cells. Now, in this case, this is a respiratory virus. So the virus gets into the cells of the respiratory mucous membranes. And from what we know about this disease so far, it looks like the virus might not be affecting the mucous membrane in the upper airway as much. That's the nasal cavity and the pharynx and the mouth. Because normally when you get a cold, you have that runny, bunged up nose, and that's caused by viral particles getting into the cells in the respiratory endothelium in the nasal cavity. It's a rhinitis, a runny nose. But it looks like this virus has a preference for the lower airways. It's going down into the lower airways, into the bronchial tree, into the bronchioles, the small airways, and indeed into the alveoli. So some patients with this disease, in fact, as far as we know, patients with this disease don't particularly have common cold type features. It's more a respiratory virus affecting the lower parts of the respiratory tract. So the viral particles get into the cells. And what the viral particles do is they hijack the genetic apparatus of the cell, and they force the cell to produce new viral particles. So the cell is supposed to be producing proteins to make itself, or to make a product that might be exported from the cell, such as mucus or an endocrine product. So it's important that cells can make proteins. That's how they're going to divide, to make new cellular structure. But a virus will hijack, literally take over that protein producing apparatus in the cell. It will say, stop producing your own proteins and start producing mine. And it forces it to produce new viral particles. And this particular coronavirus is an RNA virus. It's a ribonucleic acid virus. So the cell is forced to make new protein coats, while the RNA for the virus itself is able to replicate. So there's a point of infection. So viral illnesses are what we call obligate intracellular parasites. They can only live inside host cells. So it's not like a bacteria. So bacteria can grow in an agar plate. You can grow bacteria on top of jam at home if you want. You can grow bacteria anywhere. We're covered in bacteria. And the bacteria will grow independently of your cells or the cell of the organism that they are infecting. But viruses are not like that. They have to live inside the cells. They're obligate intracellular parasites. Take over the genetic apparatus, then the viruses literally bud from the surface, and one cell can start giving out hundreds of new viral particles. And these new viral particles will then be free on the surface. Now, in this case, if it's infecting the lungs, the viral particles are shed from the respiratory epithelial cells, and they are in the mucus on the surface of the respiratory epithelium. They're in the mucus. That means you can cough it up, sneeze it out, splutter it all over the place because it's in the respiratory mucosa. And of course, when we breathe in, the air is relatively dry, and when we breathe out, the air is relatively moist because we moisten the air. The nose, for example, moistens the air as it goes in. So the air we're breathing out is relatively moist, and it's going to contain quite a lot of water. And the viral particles will stick to these small droplets of water in our exhaled air. That's why it's called a droplet infection. And the droplets that we are breathing out that now contain, in this case, the coronavirus, other people can breathe it in, especially if we're coughing and sneezing. They can breathe it in directly, or we can cough and sneeze onto surfaces, and then someone else can put their hand on that surface and then spread that to their mucous membranes. It won't get through the intact skin, but it will go into the mucous membranes. So that's the point of infection. And from that time, the viral numbers are going to start increasing. So we get an increase in viral numbers as we've sketched out here. The viral numbers will increase. Now, what happens when the viral numbers are increasing? Well, first of all, we notice that there's a time there from when the person is first infected to when the person becomes symptomatic. So remember this red period, this red area here, everything inside this red area is symptomatic illness. This is when the patient is actually ill. So they start getting ill there. They get more and more severely ill to the maximum point of illness there. Then they start getting better there, hopefully, until that point there they're not really ill anymore. Although they'll still be very tired with post-viral fatigue, as we'll see. It takes time to recover from a virus. So what this means is there's a time from there to there when the person is incubating the illness. They're not yet sick, but they have the virus. They are incubating it. Now, what happens very often is the person will start shedding viral particles in this period. So with most viral infections, like influenza, for example, the person is going to be infectious in the incubation period. Now, what this means is the person feels fine, but they are infectious and can be infecting other people. So one person can potentially infect several other people before they even feel ill in the incubation phase of the condition. Now, it's not entirely certain as we speak at the moment whether this is true of the novel coronavirus. Some people think that it's not infectious during the incubation period, but there is evidence accumulating now that it is. And it's my personal view, given what I know about other viral infections, that this will be infectious during the incubation period. So unfortunately, I believe someone's going to be infectious during this period. And of course, the nearer they get to symptomatic illness, the higher the viral numbers are going to be because the virus is multiplying. The virus gets into a few cells, the virus multiplies in those cells shed the virus, and the virus then goes on to absorb into new cells and infects larger and larger number of cells, and the viral numbers increase, and the free viral numbers in the mucus lining the respiratory tract will also increase. Now, I hope I'm wrong, but I don't think I will be, unfortunately. And that means that this is one of the main reasons I think this disease, unfortunately, is going to spread more widely, because it looks like people are infectious when they're feeling fine. So your next door neighbour rings you up, says, I'll come around for a cup of tea, I'm feeling fine. And you say, yes, come around for a cup of tea. unbeknown to you, they could be incubating the virus. Now, the incubation period is probably 2 to 14 days. Now, 3 to 7 days is probably the most common incubation period for this virus, but it could be 2 to 14 days. So at the moment, in my country, the United Kingdom, we're flying people back from China, from Wuhan, and we are keeping them in isolated conditions for 2 weeks. And after 2 weeks, if they don't have the symptoms of the condition, they don't start getting ill, then we're going to assume that they're all right, because the incubation period can be up to 2 weeks. So that's the incubation period. And then there comes a time in an illness where you think, you're feeling all right one day, then you think, just a minute, I don't feel very well today. I just don't feel good today. I'm not my usual bouncy self today. You're not sure why. You haven't got a pain anywhere. You won't have a cough or any localizing features yet, but you just don't feel right. And that's called the prodromal phase. So there's going to be a period of time here, just at the start, where someone feels prodromal. They think they might be getting ill. They're not quite sure. But then they become sure when the actual symptoms start, and they say, oh no, I didn't think I felt quite right. I definitely am ill now. I don't feel well at all. And the illness is caused by the increase in the viral numbers. It's the viral particles that are causing the illness, and the toxins they produce and the damage that they are doing. But fortunately, the body can also protect itself against infections. And as soon as the virus is recognised by the immune system, very shortly after that, it's going to start producing some antibodies. Antibodies are the body's immune proteins. We call these the immunoglobulins. They're made mostly by the lymphocytes, this type of white blood cell. The white blood cells are the leukocytes. The type of white blood cells that produces the antibodies are the lymphocytes. So the lymphocytes recognise that this virus is not part of us. They think, just a minute, I don't recognise that molecule. That's not right. Biochemically, we call it an epitope. They recognise a foreign epitope. And they say, that's not right. I'm going to make antibodies against that because that shouldn't be there. That's an infection, and it starts making antibodies. But this process takes time. And as well as that, over time, as well as making more antibodies, the antibodies become more specific for the specific infection. Because antibodies are not innate immunity, they are specific acquired immunity. We need a specific antibody to fight a specific infection. It is quite specific. And as the immune system makes more antibodies, the antibodies become more specific and better at combating the particular antigenic organism, in this case the virus. The antigen is anything the body recognises as being foreign. And the good thing about antigens, things that the body recognises as being foreign, is they act as antibody generating molecules. So antigens are antibody generating molecules, and they generate the antibodies, which are the immune protein which is going to fight the antigen, which is going to fight the virus. And these numbers start increasing. We're starting to feel ill, but the antibody numbers are increasing now. They are increasing. And then we'll get to a point here where the viral numbers have been increasing, but now we've got an increased number of antibodies. And at this point, the antibodies are able to start killing more viral particles at a faster rate than the viral particles are able to reproduce. So now at this point, the body's starting to get on top of the infection. We're making more antibodies more quickly that are killing more viruses than the virus, more quickly than the virus is able to infect new cells. So the antibody is now combating the virus. The antibody is combating the viral antigen. And that means that the viral numbers will start to go down because it's being killed off by the antibodies. So the viral numbers will go down. And as the viral numbers go down, we're going to start feeling better. So the period of symptomatic illness is going to come to an end. But the number of antibodies will go on increasing for a period of time. So the number of antibodies will go on increasing until it plateaus out. And then they'll stay there for a period of time. And in fact, the white blood cells, the lymphocytes that have learnt how to make this antibody, they will divide, there will be a clonal expansion of those, and there'll be a residual population of what we call memory cells. The memory lymphocytes that remember exactly what this nasty antigen looks like. And if the antigen comes back, if there's a reviral infection, there'll be antibodies there. Very quickly the lymphocytes will make more antibodies and we won't get the infection again. That is why once someone has suffered from the infection, here, they will become immune to it because they have the antibodies to that infection. They can combat it, and they have the memory lymphocytes that know how to make these antibodies very quickly, again, if they need to. The trouble is every virus is a bit different. That's why this virus is causing trouble, because it's a new mutation. It's not MERS, it's not SARS, it's not one of the common cold viruses that coronaviruses. Some coronaviruses, as you probably know, can cause a common cold as well. It's most colds are caused by rhinoviruses, but coronaviruses can cause the common cold. There's 4 coronaviruses can cause the common cold. There's the MERS, the Middle Eastern Respiratory Virus Syndrome, and the severe acute respiratory syndrome, the SARS. They're coronaviruses, so SARS and MERS are coronaviruses, but they're chemically different. So the antibodies that you've made to common cold coronaviruses won't fight this novel coronavirus. That's why it's called novel. It's a new one. It's a zoonotic one. It's come from animals, as we'll look at in more detail in the next video. So after the illness, the antibodies are going to be high, so we're not going to get the infection. But there can be what we call sequelae. So a sequel is something that comes after, isn't it? A prequel comes before, a sequel comes after. So there can be sequelae from the infection. So a sequelae is any after effect that you might get after the infection has resolved. So, for example, the coronavirus, a minority of patients with coronavirus, it seems to be affecting the heart. So hopefully it's going to be a very small minority of people with coronavirus, but that could leave potentially cardiac complications afterwards in the future. So incubation period is for this coronavirus, we think is 2 to 14 days, quite long. We're not certain yet, but we think it's transmissible during the incubation phase. We think the death rate is around about 2%. The patients in China that were admitted to hospital, some of those needed high flow oxygen because this is a respiratory virus. It can adversely affect the functions of the lung, and as we said, 12% developed a cardiac injury. And the other thing about this is this virus, there seems to be a very wide distribution of levels of severity. So we know that tragically that there's been deaths from this, but other people seem to have had the infection and barely noticed it, hardly been ill at all, which is, of course, is very encouraging, because that means people in the population can become immune without being very sick, and hopefully they don't get very sick and they have no sequelae either. Whereas other people have developed severe pulmonary, severe lung complications, hypoxia, lack of oxygen in the tissues, and have tragically died as a result of this infection. So there seems to be a wide spectrum of illnesses. People seem to be febrile for have a fever for 4 or 5 days. That could be up to a week though, so this period from here to here is probably going to be around about a week for most people, duration of illness. So quite a few things that we know about the novel coronavirus based on our background understanding of other viral illnesses that we are already familiar with and their evolution.